It is recommended to trial a demonstration applicator prior to first administering ILUVIEN. Alimera Sciences will provide training and demonstration applicators. Preparation of the ILUVIEN applicator. The exterior of the tray should not be considered sterile. An assistant, non-sterile, should remove the tray from the carton and examine the tray and lid for damage. If damaged, do not use the unit. If acceptable, the assistant should peel the lid from the tray without touching the interior surface. Do not touch the interior of the tray without a sterile, gloved hand. Visually check through the viewing window of the preloaded applicator to ensure that there is a drug implant inside. Remove the applicator from the tray with sterile, gloved hands, touching only the sterile interior tray surface and applicator. The protective cap on the needle should not be removed until the patient is ready to be injected. Prior to injection, the applicator tip should be kept in the upright position to ensure that the implant is properly positioned within the applicator. To reduce the amount of air administered with the implant, the administration procedure requires 2 steps. First, before inserting the needle into the eye, push the applicator button down and slide it forward to the first stop at the curved black lines alongside the button track. Second, at the first stop, release the button and it should move to the up position. If the button does not rise to the up position, do not proceed with this unit. Insertion preparation points. Applying appropriate pressure to ensure insertion readiness. To ensure that the applicator is prepared to insert the implant, appropriate pressure must be applied to the applicator button, which may be achieved by using the thumb. With appropriate pressure, the button will not move past the first stop, noted by the curved black lines. If the button does not stop and passes the curved black lines, it is possible that appropriate pressure was not applied and that the implant is not in the correct position. ILUVIEN insertion procedure. Optimal placement of the implant is inferior to the optic disc and posterior to the equator of the eye. Measure 4 mm inferotemporal from the limbus with the aid of calipers for point of entry into the sclera. Carefully remove the protective cap from the needle and inspect the tip to ensure it is not bent. Gently displace the conjunctiva so that after withdrawing the needle, the conjunctival and scleral needle entry sites will not align. Care should be taken to avoid contact between the needle and the lid margin or lashes. Insert the needle through the conjunctiva and sclera. To release the implant, while the button is in the up position, advance the button by sliding it forward to the end of the button track and remove the needle. Insertion technique points. Achieving optimal insertion and implant placement. Optimal insertion and implant placement is most frequently achieved by a combination of precise finger positioning and applied pressure as follows. Forward movement of the applicator button is optimized when the index finger is positioned toward the rear top portion of the applicator button, as shown here. Applying slight downward pressure while pushing the applicator button forward provides optimal insertion and placement of the implant into the vitreous. Ensure the button reaches the end and stops before removing the needle. Positioning the index finger at the front or directly behind the applicator button is not recommended. Do not move the button backwards after the implant has been injected. Remove the lid speculum and perform indirect ophthalmoscopy to verify placement of the implant, adequate central retinal artery perfusion, and absence of any other complications. Intravitreal injections have been associated with endophthalmitis, eye inflammation, increased intraocular pressure, and retinal detachments. Patients should be monitored following the injection. Please review the full prescribing information and additional safety information at ILUVIEN.com.